Hi friends, Dr. Ramadevi Papalu here, your fertility specialist. I am going to tell you all the details about repeated abortions, bad obstetric history, how we can diagnose. Diagnosis is very important for any disease to give a correct treatment. So, especially in repeated abortions, we need to do lot of investigations because there are many reasons for this problem. Especially abortions we classify into first trimester, second trimester and third trimester. So, depending upon the history, especially for any clinical problem, any health problem, when you come to the doctor, history is very important because half of the diagnosis can be done with the history itself. So, if there are any abortions, we need to ask certain questions. When the abortion happened, at what period of the pregnancy. Sometimes it can even end up as a chemical pregnancy. That means only beta HCG will be positive, but scanning will give a negative result. This is called a chemical pregnancy. Once the baby appeared in the scanning, then we call it as a clinical pregnancy. So, clinical pregnancy people will come to know there was an abortion, but chemical pregnancy a lady may not be able to identify that she is pregnant herself because within 1 week or 10 days postponement she may get her period. So, she may not recognize the pregnancy at all. So, history first is whether is there any physical or mental stress and strain. Some people have they may give history of fall. So, whenever a person falls, a person will get into a shock like reaction. So, because of that hormonal changes will occur that can result into the abortion or direct injury itself if there is an injury on the stomach. If there is any psychological stress either at home or office or due to any reason, that also we need to find out. Physical stress, psychological stress, history of excessive travelling or history of fall. This history is very important. Afterwards, any history of taking medications. Some medications, without knowing that she is pregnant, she may consume some medicines. So, those medicines may affect on the pregnancy and end up in an abortion. So, history of medicines is also very important. Second trimester abortions history will be most of the time if it is because of the cervical incompetence. Abortion will occur with very little pain. Usually if there is an abortion, the lady will get lot of pain, not able to tolerate. They need to consult a doctor. But whereas a second trimester abortions, because the cervical incompetence, the pain actually during delivery is because of the nerves surrounding the cervix. So, if that opens very easily, the lady will have easy abortion with very little pain. First fluid in the abdomen will come out and afterwards the baby will just slip, baby will fall. These are the cervical incompetence symptoms and signs. So, if there is a history like this, we have to think about the cervical incompetence. And sometimes lady can abort if there are fibroids, big fibroids. Many times pregnancy will continue even if there are fibroids, but some may abort because of the fibroids. Because fibroids, not only the size and location, because of the presence of the fibroid, the peristalsis movement of the uterine musculature contraction will increase. Because of that, it can end up in a abortion. So, coming after completing the history, we need to do certain investigations. Starting from the simple investigations to know infections like any general infections or endometritis, CBP, ESR, CRP, these things will give, there is a subclinical infection. CRP most of the time will be elevated if there were infections. Next is the simplest is blood sugar, hormone analysis. Blood sugar is also very important. Of late, diabetes during pregnancy has become very common. Even in the general population also, diabetes has become very common. So, we have to do GTT, HB1AC. Even other infections like TORCH, toxoplasmosis, rubella, cytomegalovirus virus, herpes virus. These viral infections we have to identify. Then coming to the uterine anomalies, we need to do one HSG, or through HSG is an X-ray. We inject a radio opaque dye into the uterus and see the shape of the uterus and the opening of the tubes, whether they are open or closed. Here for the abortion, that is not important. Uterine shape, if there is any septum, unicornuate, bicornuate, these things will come in detail in HSG. Instead of doing HSG, we can even do sonohistosalpingogram. Here we pass normal saline into the uterus and see in the scanning machine. That also very simple, very easy to do and painless. Next is histosalpingography, sonosalpingography. Sometimes we even advise laparoscopy and hysteroscopy. Laparoscopy, hysteroscopy give much more details regarding the shape of the uterus, and hysteroscopy will give details about presence of any polyp or fibroid or any unhealthy patchy endometrium. More details we can get in hysteroscopy. Next, the most important is APL syndrome, antiphospholipid syndrome. Here there will be antibodies for the antiphospholipid antibody, anticardiolipin antibody, antinuclear antibody, lupus anticoagulant. This is for the APL syndrome. And sometimes bleeding clotting factors will be affected, because of that abortion can occur. So, in this thrombophilia panel, mostly included are factor protein C, protein S, factor 7, factor 8, factor 5, prothrombin time. So, if there is an imbalance in the bleeding clotting factors, that can end up in an abortion. Thyroid profile, we need to do T3, T4, TSH, free thyroxine, free thyroid, free T3, free T4, TSH, because thyroid is in the form of protein bound and free radical also. Free radical is the most active radical. So, we have to know about the free T3, free T4 rather than total thyroxine like a T3, T4. If we suspect any Hashimoto's, we can even need to do antithyroid antibodies. Chromosomal analysis for the fetus, and for the, if fetus material is available, we have to do chromosomal analysis to the fetus also, so that we will come to know what kind of exactly what chromosomal analysis the baby had. Is it going to be repeated in the next pregnancy or not? And mostly because this abortus material is not available, because patient consults us after abortion happens, we regularly subject the both parents, wife and husband, chromosomal analysis. But most of the time the chromosomal analysis of the parents we are getting normal, but it can result after the fertilization, there may be abnormality in the fetus. So, that is also not giving much information for the cause of the abortion, but we need to do to complete the battery of investigations for the cause of the bad obstetric history. Male factor contributing for the abortions is severe oligoasthenospermia. If the sperm number, motility, morphology all are very low, even at that stage, even we have seen certain pregnancies at 1 million also, natural pregnancy conceiving at home. So, in those cases the resultant embryo can be chromosomally abnormal, and that may be the reason for the abortion. So, we need to do semen analysis, DNA fragmentation test. So, another simple, very informative test is ultrasonography, transvaginal ultrasonography. In transvaginal ultrasonography, the uterus, any fibroids are there, adenomyosis is there, or mucus, submucous fibroids are there, submucous polyps, all these things. Ultrasonography is one very important test. This is freely available, very simple, very common. So, in ultrasonography we can identify fibroids, whether they are intramural, subserous or submucous. We can even diagnose adenomyosis, what extent the uterus is involved. So, many details we can identify in ultrasonography. So many tests we need to subject. Many times people misunderstand if we write a number of investigations, we are doing only for the sake of money. No, the reasons are many. So how do we diagnose? What is the exact reason? If we don't know the reason, the treatment also will be similarly not targeted to against the reason. So results will be poor. History is important, investigations are important in treating this bad obstetric history. Certain investigations we have to do in between the pregnancies, certain after conception. So most of the tests we have to do in between the pregnancies, and few tests, especially serum estrogen progesterone, soon after conception, within 5 days of postponement of period, if we do serum estrogen progesterone, we will come to know corpus luteum is functioning or not. If there is any doubt, if they are in low levels, we can supplement them so that endometrium will be supported, because of that pregnancy will continue. And we also need to do GTT and HB1AC at this stage only. First 12 weeks are very important for the organogenesis. So during this process, if there is serum blood sugar is more, that can result into congenital abnormalities and lead to abortions. Soon after conception, scanning, serum estrogen, progesterone and GTT. All other tests what I have told before, we have to do in between the pregnancies. Whatever reason we find, that we have to treat before she conceives. So it is complicated, but at the same time, if we proceed with a proper idea what we have to do and perform all the tests and rectify them before the lady conceives, it is easy to make the lady to pass through all the 9 months and deliver a healthy baby. Okay, na? Any doubts, please put in the comments. I will get back to you.